I work at an older adults reablement service. It's one of the wards in a major Manchester hospital. An average day for me is usually Monday to Friday. I work long days, which is 7 in the morning till 7:30 at night, and I'm meant to take 2 half-an-hour breaks. Now, unfortunately, with the NHS staffing levels, it's not always the case that you can get a second break. However, the people around me are a very dedicated team. I work with other nurses. As I say, I'm one of the band sixes, so I do some of the managerial duties as well as the specialist nursing role. So there are other band 5 nurses around me who take a team of patients and give out medicines. There are healthcare assistants within that team, and they help with the personal care of patients, ensuring that people are safe and ensuring that people are well looked after. There's then a set of doctors who check Monday to Friday on my ward specifically, and the patients are well enough to be ready to go home. They'll be checking things like blood levels to see if they're developing any infections or if there are any deficiencies. There are physiotherapists, and they help patients to rehabilitate, essentially get them mobilising, walking. There are occupational therapists who check that they're going to be okay at home and make sure that they've got proper equipment fitted if they've had a mobility change, possibly a fall whilst being in hospital. It's very common with older adults. And obviously we have managers and matrons as well, and they're the people who sort of manage the service running. So I'm usually on the ward, as I say, 7 till 7:30. It involves giving out medicines 4 times a day, so we give them at between 7 and 9, we give them between 12 and 2, 4 and 6, and then sort of 9 till 11 o'clock at night, because most people, especially older adults, are on medications 4 times a day. So a big part of the role is to make sure you're giving the right medication at the right time, and that's something you study at university. And you also study quite a lot about the pharmacology of the drugs and the anatomy of people and how that affects someone. So after we've given out medications, we then look at a thing called care planning, which is ensuring that they are receiving the right level of care and that we're doing the right thing for them. So perhaps somebody is slightly unsteady on their feet and may need assistance of 1. Perhaps somebody is very unsteady on their feet and may need assistance of 2. That's something that we monitor and recalculate whenever we look at someone's care plans, and that's something we do throughout the day. We also check a thing called observations, which is where we check manual blood pressures and patients' heart rates and oxygen levels, and that's to ensure that they are functioning healthily and well. And if there is an issue, we can escalate that to one of the senior nurses like myself, or we can escalate that to one of the doctors if we are concerned.